Welcome everyone to ABC and Data Community Engagement. I'm Celestine Emberton. I am a program manager at the Illinois Public Health Institute and a member of Data Across Sectors for Health, which is run jointly from the Illinois Public Health Institute and the Michigan Public Health Institute. And we're going to get started. In the meantime, if you want to introduce yourself in the chat, just share a little bit about where you're from, where you're joining us, what brought you to this webinar. That would be great. And I want to open with our agenda for today. So first off, we're going to do a brief introduction to the DASH framework. We're going to be doing ABC tools for engaging with community. And then we have our guest speaker joining us from the Chicago Gun Violence Research Collaborative, talking about ABCD in action. And then we will have a 30-minute segment at the end for questions, answers, and discussion. And Melissa, do you want to take us away?
I will. Thank you very much. I'd also just like to mention, I don't know if this is affecting everyone, but I have yet to find my chat feature in this particular Zoom meeting. So just FYI for others. Oh, Ron, you're the same?
Yeah.
Okay.
Well, that's something you can enable.
Yeah. I'll talk a little more slowly then, so see if Celestine can figure that out for us. But at any rate, hi, I'm Melissa Moorhead, and I'm co-director of Data Across Sectors for Health, a joint initiative of the Michigan and Illinois Public Health Institutes. If you had a moment to look at our first webinar in this series, you got to learn a little bit more about DASH and about the DASH framework there. But this is a continuing series, and so I did want to come back in at this moment to again sort of reframe and remind ourselves of the why DASH, Data Across Sectors for Health, and faculty from the Asset-Based Community Development Institute came together in the first place, and what we're hoping to get out of it and to give out of this collaboration. So it's good to see you all here. I've noticed a couple of participants that have been engaged with DASH in different ways, which is fantastic. Thanks for being here. And you hopefully will see yourselves in the framework since we've been continuing to learn along with communities as we go. Next slide, please. So the DASH framework is essentially a visualization of the trajectory DASH has been on since our inception, where we have sought to support data and information systems in bridging healthcare and what really makes up health. Both for individual people and for communities, thriving communities. So along the way, we have provided financial assistance and technical support to a number of different kinds of community collaborations, working on different outcomes for their collaborations, and applying our own technical insights and subject matter expertise in health information technology and exchange to help bridge this gap between the people doing work and data and information systems, which often exclude the people who are included either as data points or as the potential recipients of decisions, data-made decisions and interventions is what we used to say, find their place in that. So DASH has, in addition to those funding streams and learning opportunities, approaches different parts of the ecosystem differently. And so we tried to flatten it out here where we might tell data and information system technologists to always center community and equity in the work that they're doing. We also felt that there was an opportunity to work on the left-hand side of our framework, building foundations with community, to help bridge that gap between understanding and understanding data as an asset, and the perils of when data can be used against communities, and being introduced to the asset-based community development curriculum and approach. We felt it was a really good opportunity to bring together a cohort to look at applying those principles to the foundations of community collaboration, that would then support community-based, equity-focused data ecosystems that would lead to actual outcomes and promoting positive health and thriving communities. So at the end of that cohort, we took some of those experiences and made a couple of workbooks, and had the opportunity to develop this webinar series to try to dig into, again, more hands-on with interested individuals like yourselves, applying the workbooks with some actual coaching opportunities to your own collaboration efforts, and the ways, understanding ways that data can be used as an asset, and telling your community's story. So that said, I don't know, Celestine, if you're ready to introduce the faculty, or
Yeah.
I can do that. Okay, great.
Yeah, so the next part of the presentation is ABC tools with our ABCD faculty. There is Indigo, who is a Clevelander facilitator and strategist specializing in sustainable development. She has worked in philanthropy and affordable housing. Today, she is a program officer at St. Luke's Foundation, and Indigo has dedicated her career to building wealth and health in BIPOC communities and leveraging existing assets to strengthen her city. We also have Ron, who is the founder of Pacific Community Solutions Incorporated, a training, consulting, and technical assistance company focused on working with community-based initiatives, nonprofit organizations, and local governments. His work focuses on asset-based community development and organizing, community engagement and mobilization, and participatory evaluation, all for the purpose of shifting power in communities. And we also have Darryl Answer, who was born in London, England. He is currently a co-pastor of the New Community Church and founder of Verge Solutions. Through Verge Solutions, he provides consulting, training, and facilitation for organizations and communities in the areas of entrepreneurial mindset, ELI, and community development through an asset-based lens. In addition to serving in a consulting role, Darryl works in neighborhoods as a mobilizer and connector of residents and institutions around their shared vision of power, healing, and abundance. So, welcome.
Thank you so much. That was a lot. I read a lot about intros, but yeah, grateful for Celestine, folks at Dash, this amazing partnership. So yeah, myself, Ron, and Indigo are grateful to be able to be with you all today. So as mentioned, there is a workbook that was put together. So what we're sharing is a section of those two great resources, today focused on community engagement. So we just want to encourage you, if you have not, please take some time to read through those workbooks. A lot of effort was put into those. They look amazing. And yeah, what we're sharing can be found there in more detail. So I'm going to briefly just walk through one of our tools, which is called the Power Ladder. So we can move to that image. So this is a Resident Power Ladder. It's a tool that we use in ABCD. Actually, it's really interesting. I just got done walking through this tool with a number of residents who are in a houseless shelter here in Kansas City, Missouri. And it was really heartbreaking because, as you can see, the progression on this ladder, as we're talking about power, and really power really being simply defined as having agency, being able to create, being in control. And as you look at the lowest rung all the way up, so residents being recipients of services, residents as information sources, then advocates, and then being in control. As I spent time with the residents of this shelter, they couldn't name anywhere where they actually felt like they were in control. And if you're doing this type of work in a community that may be labeled, may be considered marginalized, low income, Black or brown, BIPOC community, like communities that have many of these labels, it really brings into question how we do our work. And if we're doing our work in such a way where people feel like they have some power and control. So even this group of individuals, as I had them list the various places where they find themselves, they were really like struggling with, okay, in the places where I find myself, where do I have any sense of agency, of power and control? And so I think it's really important for us as we're doing this work in community, as we think about where people are gathered, are they simply just recipients of services? Are they information sources? Are they advisors or advocates? Or are they in this place where they have control, have power, where they're able to create, where they're able to speak into an initiative, something that you are leading, and able to see this thing run through to completion? Are they a part of it through the whole process? So in asset-based community development, we really want to help those who are closest to the challenges, those who are closest to the problems, actually be the ones who have solutions. So again, this tool is a great tool. It can sometimes be used as this, because it's a ladder, then it's some type of hierarchy. We want to move away from hierarchies because we all find ourselves in situations where we are the recipients of services, and it's important. Like, as you can see on the side of my head, I was the recipient of a service earlier today, and I would only trust a doctor to do this. Right? I don't want my neighbor to be in control, right, of this. So there are places where this is totally necessary. But when it comes to community work, we really want to see those closest to the issue. I think when it comes to community transformation. So I'm going to hand it over to my colleague Indigo, who's going to walk us through some other tools.
Thanks, Darryl. So one of the tools that we use to help uncover, one, to build relationships with the communities that we're working with and that we're a part of ourselves, is to uncover their gifts, individual people's gifts. And so we all have things that we're really good at and things that we're not so good at. But it's not very often that that in community development processes or health assessment processes or surveying or any of these things that we do often for our jobs, where we're actually asking people what their skills are. And so we kind of break down those skills into 3 different types: gifts of the head, things you know a lot about or could teach, so well that you could teach; gifts of the hand, which are things that you can do really well. So example, I play volleyball all the time, and I used to coach volleyball, so I could teach some kids in the neighborhood how to play volleyball if they were interested or if there was a net nearby. Gifts of the heart are things that you care a lot about or you're passionate about. So something you spend time on where you don't get paid to do it. It's just something that you care a lot about, whether it's sorting your recycling and composting, or whether it's sex trafficking and you're working with women who have gone through that, or people who've gone through that experience. Whatever it is, gifts of the head, hands, heart are the 3 that we want to focus on. So we're going to actually break up into groups, into dyads. So you'll have an opportunity to practice with each other. It's going to be super brief. So I'd love for you to take the first minute in your breakout to just say hi, introduce yourselves, but then silently for 60 seconds, just write down a couple of your gifts, gifts of the head, heart, and or hand. And then each take a minute or 2 to share with your partner a couple of your gifts or a couple of things that you're willing to divulge. And then we'll come back together and do a very quick debrief about what that was like. Welcome back. Welcome back. All right. I think we're almost all back, or mostly back. So how was that for folks? What did you discover? Anything good you want to share? I can call folks out if you want. Amanda loved it. Is there anything in particular that you liked about it, Amanda? Do you want to share? Scarlett, you loved it too?
Yes,
All right.
it
Oh,
was
go ahead.
great. Just to say it was great. Thanks for the time.
Great, great, great. Yeah, I have found that whenever I take the time to do it, that it's difficult. Did anybody have a hard time coming up with thinking through your own gifts and skills and abilities? Maybe I'm the only one. But I think oftentimes when we have people do this activity, it can be hard to think of your own, but once you start, because we're not in the habit, our brains aren't in the habit of thinking about the positive things about ourselves, let alone other people. And so for me, it's an example of the reason why it's so important to lean into this, because in our work, so often we're focusing on deficiencies rather than skills of people. And that's damaging to our work, that's damaging to our relationships, it's damaging to our communities. And it just gives you an incomplete picture of who people are. Like none of us are only struggling with drug addiction. None of us are only struggling with homelessness. None of us are only mentally ill. Like we're made up of a lot of things, and we all have a lot of experiences to offer. So when we take the time to learn what people are good at, what people know a lot about, what people are capable of doing and completing with their bodies or their hands, and once we know what people are passionate about, it allows us the opportunity to invite them to use those skills and abilities to advance the work and to build community. And so when we do that, it often deepens our relationships with people, like authentic, human, real, reciprocal relationships with people. And it also makes them more invested in the thing that you're inviting them to do. So one example is I learned that one woman in a community I was working in is a really good cook. And she will make a tray of sandwiches or a tray of lasagna, and people will pay her to deliver it. So at the next community meeting, that's a great opportunity to say, hey, Miss Burns, would you be willing to make a tray of lasagna? And we'll pay you instead of paying Chipotle to bring in a taco bar. You can keep that money recycling in the community, help her feel important and needed and wanted, and get everybody fed at the same time. So though it seems like those are tiny, tiny little things, but it's the tiny things like that that matter. And if you don't ask what people are good at or notice and call them out and say like, hey, I noticed that you're good at this thing. Would you be willing to offer it at this time and date? Without doing that, we're missing a huge opportunity. So encourage you to think through other places where you could use these questions. It can be check-in and check-out at work meetings. It can be family meetings. It can be a family barbecue or a block party, activities that you could incorporate these questions in. So encourage you to continue with this. I'm going to pass it on to Ron.
Thanks. So hopefully in the learning conversations, you felt some sense of connection. And where the next tool sort of builds on that, it's called a learning conversation. In some places, it's just called a one-on-one. But a learning conversation is basically an intentional conversation you have with somebody one-to-one with these 5 purposes that are on the slide. You want to deepen the relationship. You want to discover and share your passions and the other person's passions, basically their hands, head, heart, what their gifts are, as well as their concerns, as well as their sort of dreams. And then identify mutual interests. So this is where once you've heard what somebody's gifts and talents and passions and concerns are, you might connect it with what you're working on. So for example, let's say you're working on a public health type thing like heart health. In learning conversations, you might meet somebody who's interested in sports, or who's interested in meditation, or who's interested in nutrition and cooking. All of those gifts are pretty easy to connect to heart health. And so you kind of identify that and point out, oh, wow, you have some gifts that could really be helpful to the kinds of things we're working on. Would you be interested in offering that gift to people in this community? And that's where you invite engagement. So identifying mutual interest and inviting engagement are steps that are tied to each other. And then in a learning conversation, you connect people to others. So you ask, who else should I talk to in this neighborhood based on, our interest in heart health, or our interest in community well-being, our interest in reducing violence, whatever it is you're working on. The mistake a lot of groups make is they start a series of listening conversations in a community and think they have to cold call everybody. And you don't have to cold call anybody. You just talk to the first person in the community, and then ask them who else you should talk to. And then you contact the other people and say, hey, Indigo and I were talking and she thought it'd be good if we talked. And so it's a more relational connection to starting the next conversation. Just go to the next slide. When we talk about discovering people's passions, we kind of break it into three categories. What are their hopes and dreams? What do they want to see for their life and for their community, for their neighbors? What are their concerns and fears? What bothers them? What would they like to see stopped? And individual gifts, the hands, head, heart stuff. By focusing on those three, we're basically listening to people's motivation to act. These are the things that we as humans act on. There's a lot of things we care about. There's a few things that we'll actually take time to act on. Nobody you talk to is sitting on free time. Everybody is sitting on the same amount of time and lots of different obligations. And so whether or not somebody gets engaged in the work you're doing in the community or in their community has to do with these three things. And so that's what we're listening for when we listen to their passions. Go ahead to the next slide. I think this is a page from the workbook. Yeah, so again, Darryl talked about the workbook online, and maybe we can put a link to it out. Maybe not, because we don't have chat right now, but we can email. But in the workbook, I think it's page like 16, are a list of questions that help you discover those things. So we encourage you to, and there's in the workbook, there's a lot of logistics on how to do this, and it should be pretty easy to walk through how to do learning conversations and how to set up a campaign to do it. But we do provide a list of the kinds of questions that help unpack these motivations to act. Go to the next slide. Just a couple of reminders that this is the kind of thing you set an appointment for with somebody, because that shows them respect. We set appointments for people who we often pay to be with or respect, doctors, dentists, counselors, others. And so we set an appointment with somebody, we meet with them, and just say, I just want to get to know you and share more about what we're doing. If there's a connection that came up in the first place, you revisit that. And the prepare to share piece is really important. It just means that in a learning conversation, it's not an interview. An interview creates an immediate power differential and doesn't create a relationship, because you leave with all the information about the other person. You leave with power. They leave feeling extracted from. So in a learning conversation, you're sharing yourself as well as listening. And that's what makes the connection, just as you did in hands, head, heart. And you want to keep them under 45 minutes. Even if it's going great, schedule another meeting. Because if you don't, the next time you want to meet with this person, they're going to be like, oh God, Darryl takes an hour and a half, even if they were doing all the talking. So you want to keep it. And then right afterwards, you write down notes. Because if you're doing a listening campaign, you're going to mix people up. And you don't want to come and say, hey, Dan, how's your daughter? And he's like, I don't have a daughter. Make some notes after the meeting. There's lots of logistics. They're in the book. These are ones we really like to highlight. And next slide, just in case you're thinking, wow, that takes a lot of time. It does. It does take a lot of time, but it's 45 minutes with the person, 5 to 10 minutes of phone calls or emails to set it up, 5 or 10 minutes to get there. So you spent an hour and 15, basically the time it takes you in a week to clean out your email box of junk, and you really deeply connect with another person. What I recommend is when groups really want to do some legit community engagement is that you do a campaign. And if you have a 4-person team in this example that we're going to share, who commit to 4 weeks of learning conversations, and they commit to just do 2 a week. So talking about like a 3-hour a week commitment for 4 weeks. You can get quite a ways. Next slide. So in this example, this example starts with 5 people. They do turn learning conversations in the first week. So they've talked to 10 folks. Inevitably, if you talk to 10 people, one of them will say, I love this, I want to be part of it. Quick, go open the manual, show them how to do it, have them do a couple of people. So next week you have 6 people working on it, 12 conversations. Week 3 is 7, because it's going to happen again. Somebody else is going to say, I want to be part of this. I've never had it not happen that way. Week 4 is really week 5, because we all know there's that week that gets away from everybody. So the 4-week campaign always becomes a 5 or 6 week campaign, but you still get those next 16 people to listen to. And what happens is in 5 or 6 weeks, what started out as 4 people ends up being 52 people in your community deeply listened to, who shared their gifts and passions. That will have more impact than any number of email announcements you can send out, or community barbecues or things like that. You will have, and what I recommend is that you sort of put the aggregate results together and you have a party later. I was working with a church that was a historically German Lutheran church in a downtown multicultural area, but they were right near very hip German brew pub. And so they had a party there and invited all the people they had talked to come and shared the results they had found about the neighborhood. People loved hearing about what other people in the neighborhood said. And then they met each other, and all kinds of great things came out of that. And in fact, in this case, that church ended up hosting the offices of the LGBTQ center in the downtown area had developed a library that had become too in demand for their space, and the church ended up using some of its space to host it, which would have never come if these learning conversations with very disinterested people hadn't come together. So highly recommend Learning Conversation Campaign. We'll have question and answer towards the end of this webinar about it. And we also are going to be holding office hours. So if you want to get one going, you can get in contact with us, or we can chat about it during the office hours, which will be announced at the end of the webinar. But now I want to turn it over to some people who've used this tool and other tools to do great work in Chicago. So I'll hand it to Celestine to better introduce our guest speakers.
Yeah, thanks, Ron. So our next speaker is Dan Schober. He is an assistant professor at DePaul University. He teaches in the Master of Public Health program, and his research has focused on health disparities driven by violence and chronic disease. Dan's work in violence prevention has involved examining racial disparities in homicide and suicide across large cities, studying the protective effects of social capital on youth violence, and facilitating participatory research to address the social determinants of gun violence with urban youth. Dan has served as the director of the Chicago Gun Violence Research Collaborative from 2020 to 2022. He earned his PhD from the University of Kansas in behavioral psychology and his Master of Public Health degree from the University of Kansas Medical Center. And welcome, Dan. And I'll do a brief introduction to the collaborative. The Chicago Gun Violence Research Collaborative Graduate Student Fellowship is a 15-week program that brings together professors and public health professionals to mentor graduate students across various academic disciplines from Chicago-based universities. And the CGVRC partners with Kids Off the Block to address gun violence in partnership with youth. Take it away, Dan.
Great. Well, thank you so much, Celestine, for the introduction. We can go to the next slide. As Celestine mentioned, the Chicago Gun Violence Research Collaborative, it's a fellowship for graduate students. And we have faculty mentors. These are public health professionals and professors like myself. And we try to recruit between 8 and 10 graduate students to be a part of this fellowship. And what we hope to do is have these graduate student fellows implement a field-based project where they're addressing gun violence, and hopefully they can use what they learned across their professional lives. And their professional lives look very different. Some of them are pre-med, some of them are nursing students, some are in public health or psychology. So we see gun violence as a very much a multidisciplinary problem, a problem that requires multidisciplinary solutions. And so this is kind of one of the ways that we hope to address gun violence in Chicago. As Celestine mentioned, we partnered with Kids Off the Block, and our hope was to really elevate the voice of the young people that they serve, to really address some of the inequities that come with health and gun violence, and to also try to create change. And Kids Off the Block, they're in the Roseland neighborhood of Chicago, so that's a neighborhood on the far south side. It's a neighborhood that historically has faced a lot of disinvestment. The executive director, her name is Diane Latiker, and she has been very involved in this project and a true partner in this work. And as Celestine mentioned, I'm the outgoing director, so currently it's led by Ashley Wolf, who's a pediatrician at UChicago Medicine. But I continue to stay involved and really did enjoy my time as director. We can go to the next slide here. So what we did is we held learning conversations from roughly December of 2021 through May of 2022. And what we did in these learning conversations is try to get at two things. One was among the young people that were in the room, what are your concerns about the neighborhood conditions that lead to gun violence? The second thing we try to get at is what are some of the assets in the community that we together can leverage to try to address the issue of gun violence. And as part of these learning conversations, we did the Head, Hands, Hearts activity, and I was so delighted to hear of all the different talents and passions that the young people have. It ranged from talents in sports to being good family members and community members, to having talents with their hands, like with things like waving, which is a type of hairstyling. So really good, rich conversations, and the Head, Hands, Heart really did create some rapport between the folks who were leading the initiative and the students and the young people. The young people themselves were 25 youth. They were roughly 70% boys or males. They range in age from 14 to 24, and that's a fairly wide range. The reason that we had a range of 24 is because some of the young people that had been involved in the program since kind of the beginning continued to be involved. So they were kind of alumni of the program that stayed involved and were involved in this project. And all the young people were Black or African American. I want to say a little bit about data, because data was really important to us. The city of Chicago and the Chicago Department of Public Health, they administer an annual survey. It's called the Healthy Chicago Survey. And what it does is survey a few thousand Chicagoans, all adults, 18 and older. And basically, they ask them a series of different things about health, one of which is about neighborhood safety perceptions. And we were able to pull some of this data from the Chicago Health Atlas, which is a website where the city of Chicago makes some of this data available. And we did use some of this data to see some of the inequities in gun violence and safety. For example, the survey revealed that only 45% of people that lived in the Roseland neighborhood felt safe most or all of the time. Citywide, 62.7%, nearly 63%, felt safe most or all of the time. So we saw a big inequity. One of the challenges was that these were all adults that were surveyed for the Healthy Chicago survey. So we wanted to collect data from, with and from these young people. We found that only 36% of the young people in Roseland felt safe most or all the time. Again, that's compared to 45% of adults. So very different perspectives. We were able to use some of the data, but we didn't have every data point that we wanted to have. And what we learned throughout this process is that in these learning conversations and these activities, we were really able to get more contextual factors that helped us better understand the situation, the community, and the data that we did have. So we can go to the next slide here. Actually, we'll go back one slide. One of the things we did was a concern survey, and this is where youth brainstormed community concerns related to gun violence. And the concern survey methodology is documented on the Community Toolbox website. I believe that's listed in the workbook as well. So basically, it has people in neighborhoods and communities come up with some of their key concerns, and then it guides you through how to develop a survey that would help you gather more data or information on those concerns. So the CGVRC mentors and students took these concerns, and these concerns were brainstormed by the young people. You can see that in the top panel on the left. And when we gave them this task of a concern survey, they thought about it as strengths and weaknesses. So you can kind of see that in that second panel. And let me just point out, one of the strengths that they listed was leadership. That's kind of near the bottom of that picture. You may not be able to make out the text there, but leadership is on there as a strength. And then a weakness to point out is the third item. It was no Black ownership. And what that meant was a lack of Black-owned businesses in the Roseland neighborhood. So the way that translated to the survey, we had 55 items that we developed based on what these several groups brainstormed. And this 55 item survey had the youth then rate the importance of the issue on a 0 to 4 scale, as well as their satisfaction or lack thereof with the community's ability to address this issue. So no Black ownership was one of what these young men saw as a weakness. The way that translated into this concern survey was an item that reads, thriving Black-owned business in Roseland. And that's number 2 on that survey. Again, it may be a little bit too small to read, but that was how we developed the concern survey. We can go to the next slide. And so here we see the top 10 concerns that factor in both the importance of the concern and the level of satisfaction or lack thereof with the concern. So the top concern among these youth were poverty reduction efforts in Roseland. And I found this to be really interesting, and I was really glad to see this. To me, it said that the young people who designed and took this survey recognized that gun violence isn't just about the presence of guns, although that's important, but they recognized that it was about the broad social conditions that lead to gun violence. So poverty was concern number 1. Concerns 2, 3, 4, and 5 are very related to gun violence. They are community violence, guns and firearms, gang activity, and crime in the neighborhood. Number 6 is really interesting. It's the availability of good food in Roseland. To me, as a public health professor, this really heartened me. We would call food insecurity a social determinant of health, and for these young people to connect food insecurity and the lack of availability of good food in the community to something like gun violence was really impressive to me. COVID-19 was concern number 7. That was no surprise because this happened kind of on the tail end of the COVID pandemic. At the time, for most of these 7 learning conversations, the young people had returned to school, but they were still experiencing a lot of the negative post-COVID effects of returning to school, trying to catch up, waiting for their vaccines, things like that. Number 8 was a systemic concern, and it was about the criminal justice system and its impact on Roseland. So again, I was very proud that they were able to see the connection between some of these systems and gun violence. And then 9 and 10 were about stress and mental health. And these were major concerns despite being 9 and 10. And there were concerns that came up in our learning conversations and in our community forum, which I'll talk about in just a bit. So we can go to the next slide. We also conducted a number of key stakeholder interviews. And one of the learning conversations that we had with the young people, they recommended the people that we should talk to. And so the CGVRC mentors and students conducted these interviews, and they were conducted with an elected official, business leader, 3 law enforcement officers, an ER physician, a social service provider that worked with families and parents. 2 social service providers, and then another social service provider that managed the process of violence interruption, which is really about hiring people who have lived experience, in the neighborhood to interrupt the cycle of gun violence. So we conducted these interviews, and again, we asked the same questions. What are your concerns about the neighborhood conditions that lead to gun violence? And what are the assets in the community that can be leveraged to try to create change. We can go to the next slide. If we could just advance one slide to the next one. There we go. So I'll just talk about some of the assets that came up. We looked at the different assets that these stakeholders mentioned, and they really kind of came out into two different categories: community organizations and people. So for example, one of the interviewees said, there's all types of organizations in Roseland that are trying to reach out and get youth involved. Right? So very much community organizations doing their work. There are many of them, but that is a real strength of the community. Second was people, and one of the interviewees said, the people in the community are our biggest resource. We have retired teachers who still want to be active. We have retired policemen and women who still want to be active. So kind of what we took away from this is that when you really listen to the community over time, that is the best way to identify some of these very promising overarching assets like community organizations and people. We can move to the next slide. So we did hold a community forum. We took our results of these 7 learning conversations to the community via a community-wide forum. And again, we had generated some data from these learning conversations on violence exposure, the concern survey that I shared with you, the key stakeholder interviews, and a kind of an ongoing discussion of community assets. And on the right there, you see just an article that was done by a Chicago-based periodical called Block Club Chicago on this community forum. We can go to the next slide. Ron had mentioned the importance of talking about aggregate results that come out of learning conversations, and then having a party to discuss and to celebrate. And this is exactly what we did. We had our community forum. We had 61 people attend. These were people that represented nonprofit organizations. They represented violence prevention organizations. Some of them were from academic institutions. And of course, the youth were also involved in this community forum. So one of the things we did is we broke out into 6 small groups, and we really talked about all the results that we generated. And we tried to do some meaning making of of those results and what the implications of those results were for the community. Then we had young person in each of those 6 groups step up to the microphone, as you see in this picture, and really describe what the results were, what was discussed in that small group, and what it means to the youth in Roseland. And again, mental health and the need for mental health services was one thing that really came out as needed in the community and not really all that available. Go to the next slide. If we think about some of the bigger things that came out of this, Kids Off the Block really hoped to develop unused commercial space into a center for technology, entrepreneurship, and the arts. And although this isn't mental health specifically, they saw this as a way to really promote mental health among young people. Kids Off the Block did have the right to the space. You see the actual space on the left there, but they hadn't secured funding to redevelop it. And they were looking to partner with different organizations across Roseland and Chicago to staff these courses and workshops in technology, entrepreneurship, and the arts. So we can go to the next slide. And what we did with we had a DASH grant. And what we did with this is we really took a day, we cleaned up the space, and we did a lot of visioning for what we want it to be and why it would matter to the community and to young people in Roseland. So I want to go through 2 quotes that came out of that session. One person said, we can have kids come in after school, not hang out in the streets, come to the center, chill out, avoid the gang life and the street life. So that was a real connection to gun violence. The young people saw it as as an alternative to gun violence. And if you had a place to hang out and to come after school, you might be able to avoid some of those alternative activities that might enable gun violence. The second quote is someone said, we don't have much opportunities. This is just the beginning of us building our community up to make a better place for young Black people. So they saw it not just as an alternative to gun violence, but also as a way to make the community better and stronger. One of the things I walked away with from this experience was that the best collaborations really help expedite community-determined action plans. This gets back to the discussion about residents as being in control, right? And so finding ways to partner with communities to empower them and to keep them in control was really important in this project. So we can go to the final slide here. So 3 lessons learned from the DASH ABCD cohorts. One was that health equity data is in fact available, at least in Chicago, but communities can really bring a lot of specificity to that data. The data doesn't always necessarily fit the situation, but the community can help fill in where it doesn't fit and really help you, use that data for creating change. Second is community assets come in many forms, and that listening to the community over time is the best way to identify assets that have the most potential to bring about change. And third, the best collaborations really do help expedite community-determined goals, initiatives, and action plans. So thank you. It was a really meaningful project to us in Chicago, and we would not have been able to do the cleanup and the visioning without the support of DASH.
Thanks, Dan. So we are almost at the end of the webinar portion, and I just wanted to share a little about the office hours opportunity that we have. So far, we have 2 sessions available coming up next week and on June 25th. And it is basically a space to bring your questions, whether or not they're directly related to ABCD, if you see any sort of connection there, and connect with other peers in that space. And the faculty will be at those sessions, and we will be emailing the sign up to everyone at this webinar. So if you're interested in that, stay tuned. And that concludes the webinar. Thank you, everyone, especially to our presenters. And their contact information is here if you want to reach out to them. And there will also be, if we can figure out the chat, a link to the slides, but if not, that will be available via email as well. And now we will start the Q&A/discussion portion. And I guess since the chat isn't working, if you want to come off mute to ask your questions, that would be great. And thank you.
Hi, my name is Amanda Nochi. Let me also turn on my video. So I had spoken to Allison from, she's also part of the ABCD movement, and she had mentioned, I believe, is it Ron and Darryl or Ron and Dan? Who were the 2 individuals who worked on the DASH booklet, the ABCD booklet?
Yeah, that was Ron and myself.
Okay, gotcha. Thank you. So I work for the health department in San Antonio, Texas, and we have a program that started 10 years ago. We just hit 10 years this year, and we utilize the DASH workbook. So when it came out like last year, we're like, oh my gosh, this is amazing. So thank you.
That's cool. That's awesome.
Oh, you're the one. That's great.
Oh, did Allison tell you about me?
No, I'm
Or what?
kidding. No.
Okay.
I'm glad somebody you never know.
Yeah,
like,
yeah, that's
right. Out there.
Yeah. No, that's so good. Yeah, that's so.
Well,
if you don't mind, just could you give us just like how has that been implementing the workbook?
Yeah. So we started this program 10 years ago, and within the health department, after decades of telling people to eat this, not that, we realized there was still a reason why the rates of diabetes and preventable diseases were still rising in our city. And so we got a grant from the CDC to actually go into 15 different communities. At the time it was 10, but we assigned a community health worker in each of those communities. These individuals, myself included, we didn't have a health background. We were just already active in the community. So basically picking PLEs, people with lived experiences, and giving them the opportunity to now get paid for what they're already doing in the community. And over the years, like there has been some motivation that has waned. You know, we had, when we first started, everyone was gung ho. We actually had someone from the ABCD Institute teach us about the framework, and there was a lot of confusion. I eventually left and applied ABCD to the Peace Corps, my village in the Peace Corps, and it was amazing. And so after my two communities that I had applied it to, I said, I want to teach. I want to continue. I want to really hone this skill. So I came back, and now we've expanded to 15 communities, and I'm teaching the newer folks about ABCD and how to implement it. It has been a bit daunting, even though it's pretty intuitive. It is daunting for people. So having the booklet as a guide, like an ever-present guide for them to refer back to, or even in the moment when they're talking to the neighbors, I show them like, hey, you can even split the book up into sessions. You know, so for this first session with this group of people, you can go over this topic and then move together through the book so that yeah, they feel more comfortable. But it's been great.
It's great. Thank you for
Thank
sharing.
you for sharing that experience. I'm really curious, since I'm representing the data infrastructure side of the experiment. How do you find that element of the workbook? Does it resonate with community members right away, or is it something that helps to sort of remind people about the value that they can wield with community data?
So I think data in general. So since 2014, I've been trying to figure out a way of how, like, working in the community, we can also showcase that data and share it with the community members, and how to format it so that it is digestible and it is, you know, well received. But I'm still struggling with how to do that. And as a department, yeah, we have not mastered that even for ourselves. So we're still utilizing, you know, attendance sheets. And, you know, but I was saying, how do we speak to the attrition that happened from people, you know, rekindling their empowerment of themselves, you know, or remembering, oh yeah, I have this gift. I've had people who have jumped onto what we were doing, and then they left after several months of volunteering with us because they went back to school, or they started on their own path volunteering elsewhere, or they started doing other stuff. So on paper, that attrition looks bad when in reality it's actually, you know, in support of the program. So we're still trying to figure out how to do all that. So if you have any ideas, I'd love to talk to you guys.
A learning journey for all of us, I think, for sure.
I had a question for Dan. How successful were you with the 60 odd people that you uh, attracted to that meeting in getting stakeholders or people, decision-making kind of people there? And then the second part is, I mean, in my work, it's hard to get people to come to a meeting. And how did you manage to get 60 people? And if you didn't reach your goal, what do you think was the reason?
Yeah, great question. I think we had good representation from grassroots people. So people at nonprofit agencies, people working directly with the issue of violence prevention and gun violence. I think if you asked Diane, who's the executive director of Kids Off the Block, she felt both elated to co-host an event like this, but also maybe a little bit disappointed that we didn't have certain people come to the conversation. The aldermen, which in Chicago we call them aldermen, they'd typically be called city councilmen in other cities. We did invite, and he declined to come. There's a lot of history to that. But I think what we did have is people that could really help us make sense of the information that we gathered and processed over the course of those 7 learning conversations. And it was able to help us solidify that the next step would be to find a way to make the tech center become a real thing. That was something the community had always wanted to do, but just didn't have the external forces pushing on them to get it done. So it was kind of a reiteration of what they knew they wanted to do, but the community forum of 60-ish people gave them the motivation to really move into action and to get things done. And they had applied for a grant from the city of Chicago for over $1 million to try to refurbish that building. So it also kind of renewed a campaign to get in touch with the mayor. Interestingly, Diane had a good personal relationship with the mayor. The mayor kept saying, it's going to happen, it's going to happen. So it really kind of renewed that advocacy a little bit. And then Chicago got a new mayor about a year later. So it sort of presented a challenge, but it did give a lot of hope and momentum, and it brought some action back to something that was a little bit dormant. I think having a follow-up would be good. And I think the work still continues. They currently have a Department of Justice grant, so larger grants, to do a lot of the data collection and a lot of the support services. So I would say it's a long-term thing to get the right people to the meetings and to get them to be champions of the work.
I think that this case points out as well that ABCD is particularly useful in environments where folks don't have the attention of decision makers, because it allows communities of people to focus inward and pay attention to each other and generate some energy and momentum around things that they can do for themselves based on their gifts and passions and interests, and puts them in relationship to do it without needing any outside permission. And therefore they can start getting stuff done. And that's often what it takes to get the attention of decision makers. There's many ABCD stories that start with, we couldn't get the mayor, the council member to return our calls, and end with, we were invited to be part of an advisory committee because they started getting stuff done. I had one group who even then turned down the advisory committee and said, you can be on our advisory committee. And then if the relationship goes well, we'll think about yours. And it was really, we talk about it as, it's not, if you're not getting a seat at the table, just make your own table. And trust me, the politicians will find you because they like to be at tables. It's what they do.
Thank you. That's very interesting and helpful. Yeah.
I have another question if no one else does. But Melissa Moorhead, I think I connected with you last year. Yeah, okay. And we were playing phone tag for a little bit, or email tag. Yeah, would you be interested in brainstorming community data and just the formatting of that?
I absolutely would be, but I think that's also an even better thing to bring to the office hours. So that could be a place to start. I think, you have, from the health department perspective, maybe that is a little bit more of a separate group, but in general, I'm really interested in bringing in folks who are doing the ABCD work in proximity with the data aspects of it. So can we start there and see where it goes?
Yeah, sure.
Yeah.
And those are the upcoming, like June 11th, or is that? Okay, gotcha.
Right.
Awesome, thank you.
Yeah, one's around the corner, so we'll look forward to having you there.
Thank you.
So anyone else want to tee up a conversation, or I'm just thinking in the long email that we'll need to send out thanks to no text and the like. We are interested in putting any precision around the office hours, and then whether or not there might be opportunities to go into deeper coaching or sort of one-to-one relationships there as well. So interested in hearing from others.
I just had hi everyone. I'm Alex. I had a question come to mind about the resident power ladder. Something that stuck out to me was about the ways to create more opportunities for residents or community members to get increased control or larger agency. And so I guess I just have a general question around what does that look like in practice, and like how do you continue that long term or ongoing, um, with the thought of, you know, I know for some uh, or examples I've heard of, like with the compensation aspect, how does that impact that as well, when community members are being compensated for their time as well. So just elaboration on that for sure.
Yeah, I can begin since I shared briefly on that tool. Yeah, I think that's a great question. And even bringing in the compensation piece adds a different level of complexity to it. I think because it's fresh in my mind, this organization I'm currently working with that serves a number of houseless individuals, I've been working with their clients in this asset-based approach and mindset shifting. And the director came to me after our session last week and said, I want this to be throughout the culture of the organization. And so looking at institutions, how do we create a culture within the organization where the folks we serve are able to step into their own power? That then brings into question how we exist as an organization. Because what I told him was, it's one thing for me to, have an exercise where they are to explore the spaces where they're in power. But if we want to be an organization or an institution that allows people to walk in that, then that means we have to be willing to shift some things to create space where people then are able to come up with ideas and then execute on their ideas. So it's almost like what Ron was talking about with creating tables. Like, how do you create an environment as an organization that encourages people to create their own tables? And that is almost scary for us, who are leading organizations, because then what we're saying is like, oh no, I actually want you to step into your own power or your own agency. So there's like an institutional version of that, and then there's a community version of that. Community version is kind of like what Indigo talked about, or what Ron had talked about, things that are happening outside in community. But I think within an organization, Alex, if you're working in an organization and wanting to see more people step into their power, I think it's the culture that already exists within your organization. Does it give permission to that? Otherwise it's just going to lead to a lot of frustration. So I think before we talk about the compensation piece, I think there needs to be a conversation around the culture of the organization and the institution. Is it in a place that is going to allow people to really come up with their own ideas? And one of the things we say in ABCD is leading by stepping back, which I think we talk about that in the workbook. So having a culture within your organization that leads in such a way that's willing to step back and allow people to be in control and to have that power. And then for resources, part of that culture is then saying, okay, we're going to redirect resources, not just dollars, but also redirect resources to individuals that then frees them up to actually execute on those. I know that was a lot, but my colleagues, if they want to add any to that, and Alex, if that makes sense, but I think that's where I would begin.
I'll mention that in a program that Dash is currently operating, that question of compensation is a big part of our shared learning journey at the moment, because it is so complex. But one of the things that we have discovered in those conversations, it goes back again to the, building foundations with community and taking that asset-based approach, bringing people together in conversation in a shared way, can help facilitate some exercises or some understanding of where compensation is correct or not correct, if that makes any sense. So there are, for example, some collaborations where people decided that compensation would not factor in because they are in true community with each other and assets are shared somewhat equally, or however they have determined to do it. In those collaborations, in collaborations where compensation does come up, that is tricky because of the power differentials that it can support. So it's just another part of using data in your collaborations. I think our first webinar had a little bit more about asset mapping and some other parts of the ABCD framework. But thinking through in that vein, like, who is benefiting from conditions as they are, who is being compensated or getting like actual benefit out of conditions as they are, and how then who will benefit by it changing, and how to support that change, is all part of the conversation that I think comes out from the asset-based approach. So if from the aspect of an organization who is looking for dollars to create a change, I think it makes sense that some of those dollars have to go to the people who are the experts, to pay people for their expertise in that conversation. But it's always going to be a big part of a conversation in the community collaboration, I hope. That's it's a good question, though, obviously. Lots going on. Amanda, do you mind me asking if in the communities that you've been shepherding, did you say that you are compensating folks for their expertise in the community, or?
No, we don't. It's solely based off of the motivation. Again, pairing up and supporting, and however we can, the individuals who are already doing the work, but then also finding those who wanted to do the work, but just never were given the permission, or they feel like they need permission. So now when we come alongside them, I'm like, hey, let's do this. You can set up a table in your front yard. No one's going to tell you no. And kind of just helping people feel more comfortable with that agency that we were talking about.
Yeah, I think that sway sometimes is as in some conditions and maybe more important than dollars. So if someone is getting some that value, extracting value from the collaboration, then I think it makes sense that has to be shared compensation. But coming together and saying, like, this is just an asset that we have. We might not have the money, but we can share our assets in our pull in governmental public health, or as an institution in the community, or as a community leader. Like I said, sometimes it doesn't come up, and sometimes communities don't think about it in that way even.
Mm-hmm. And also like swag, like water bottles. We have neighbors who they'll host cooking demonstrations. Okay, everybody who attends gets a free apron. So again, there's other ways to incentivize people without relying on dollars, because that does become a slippery slope of, like individuals who would have done it for free. Now, when you start compensating them and then that money stops, the expectation has now changed. So.
Did we have any other questions, or did we
I
want to
have
end a little
one.
early? Yeah, go ahead.
I have one last one. So I know, I forget what year it was, but fairly recently, the Dash and Dash, is it an institute with Dash? They had offered different cities or different entities within different cities a grant. Are you guys looking to do that again, or was that just a pilot during like COVID or after COVID?
So good question, and one that kind of continues to evolve. Dash started out primarily as a regranting program office of the Robert Wood Johnson Foundation. But as we have continued on, we have tried to continue to find funds and make them available for regranting as part of our, supports and activity streams. And with being mindful of, translating out the lessons like this ABCD. So kind of complicated situation. Right now we are not recruiting for a funding program, although we are investigating bringing in a couple more communities to a learning opportunity with the case made, which is a different sort of approach to asset framing in your community, on the far end of our framework, looking to build on those collaborations to create policy and mental model change. So yeah, that way, keep an eye out, I guess, on our newsletters. I wish we had the chat because we have a number of different things, but also I'll try to remember to reach out to you on LinkedIn too, to connect you to where we are doing some activities that are giving rise to these learnings and making sure that you are connected moving forward.
Thank you. I appreciate that, because even in the circles where the health department or such a large institution is not needed or welcomed, I do this work on my own time. And I know a number of community partners that I'd like to connect with you guys as well. So thank you.
Any last questions? I think we have time for maybe one. Okay, well, I will stop the recording.